Welcome to Spotlight. Peace and blessings, everyone. I'm Edjuenka, and we have a very important program for you this evening. So I'm encouraging you to call all your friends around the world and tell them that Spotlight is streaming live on jtvlive.net. As you know, or you may not know, Regional HIV Testing Day is upon us, and once again it's time for us to know our status. And with me this evening is Miss Noeline Levans Clark. She is going to be under the spotlight. She's the National AIDS Program Coordinator, and there's a lot of information still to get out there so that we can stem the continuous tide of the rate of infection. So we are going to talk about how easy it is to get testing, what testing consists of. We are going to demonstrate a test this evening, and we're going to talk about the impact of the HIV on the environment, your families, knowing your status, what does that do for you, how does that help you in early treatment. So it's going to be a lot of information that we're going to be talking about this evening. So you keep it locked right here to Spotlight. We're going to take a word from our sponsors, and we're going to come right back.
This program is sponsored by the law firm of J.S. Archibald & Co. and by the trust company J.S. Archibald Trust Services Limited, both of Roadtown, Tortola, BVI.
Welcome back to Spotlight, Ms. Noeline Levans Clark. I want to welcome you again.
Thank you again.
To Spotlight.
Thank you very much.
Yes. Have you had a co-host?
Yes.
HIV testing day is here.
It's here again.
How many days? 1 day, 2 days, 3 days?
Well, usually it would be the Friday, the last Friday of every June. But this year we've expanded the week. We started off with the New Testament Church of God, offering HIV counseling and testing to the congregation on Sunday gone. The New Testament Church of God actually kicked off HIV testing for the year because I was invited by the Men's Fellowship to come in and present on HIV/AIDS, and most of the men there got tested.
Oh, that's good.
Yeah, the same night. And so it was extended to the congregation on Sunday. Today, Tuesday, we went to Right Way Food Markets and Roadtown Wholesale and offered HIV counseling and testing to their staff. And then Friday, the big day, of course, we will be at Scotiabank BVI in Roadtown, Tortola, Scotiabank in the Valley Virgin Gorda, the Anegada Clinic in the Settlement Anegada, and for our first time, Joss Van Dyke. Joss Van Dyke Clinic.
On Friday, and Friday is what, the 29th? The 29th?
Yes.
Which is the actual day, regional testing day. You're going to be covering simultaneously
all 4 sites.
All 4 sites.
Yes, and then on Sunday we're scheduled to go to the Upper Room Victory Church at the Licks Hill in East End.
More men than women getting tested? You got a ratio?
I am surprised. I am very surprised. A lot of men, and not just men, but men coming for the first time. The first time in their lives they ever having an HIV test. And we commend them. We make a big deal about it because, I mean, that takes a lot of man to do.
Yeah. So the testing though has become really, really easy.
Yes.
And so you could do you get back your results in
20 minutes.
In 20 minutes. Yeah. And again, when was the last time I was tested?
You were tested. You were tested last year on the Spotlight before regional testing day, and then you came in for testing again when we were launching the posters to be
so a year ago I was tested.
Yes.
So it's time I'm overdue for a test.
Well, we could say that, yes.
Yeah. So how often should you be tested?
Usually, right now, HIV testing is recommended for to be done at your annual physical, especially if you're sexually active.
Okay.
Right. At least once a year. If you are having unprotected sex or if you're having multiple sex partners, we would advocate every 3 months.
Okay.
Right. Depending on your lifestyle.
Depending on your lifestyle.
Right.
So once a year is good. Once a year is good for me.
Yes.
Right? Now, how important it is for me to know my status. What does that do for me, having that knowledge?
Knowledge is power, and I always say once you know, you're good to go. If you test negative, you can do whatever it takes to keep it so. Whether you started indulging in sex or not, if you're a virgin, you can still have an HIV test, because you know from where you stand right now, and when you go forward, you know exactly what you're going with. If you test positive, you can get the care and treatment that you need to prevent HIV/AIDS. I know a lot of persons who tested for HIV found out that they were positive probably 2 to 3 months after being infected, and they are doing so well clinically because they were able to get themselves monitored and treated early, and AIDS is a long way off.
Okay, so when you found, if you test positive and you start the early treatment, what happens? The virus is suppressed.
And that's what happened with Magic Johnson. That's why he can live so long and have undetectable viral loads. His viral loads is below 20. He's still HIV positive, but it's so low they term it undetectable. And we have a lot of people in the territory who have undetectable levels. Not all HIV positive persons will achieve that, but starting treatment early can encourage that.
So it's important.
Yes.
So I think then it's time for my test.
Yes.
Right. So let's show how easy it is.
Okay. If a person to get tested. If a person comes to a testing site, we'll give you a ticket stub. We don't want your name. We don't want to know who you are. We'll give you a ticket stub, and on the ticket stub will have a number, and that number will be your number for the entire time of testing. You will then be called to be pre-counseled, where a counselor will prepare you for your HIV test, ensure that you are ready to receive your results, because having a positive HIV test and even a negative can cause adjustments and changes in your life. So after having your pre-counseling, you come to the tester, and the tester will open a brand new test kit. This one expires July 2014, has 2 more years on it. And we open it, and this is the solution from which we will put here on the stand that the blood goes into, and this is the actual test kit. Can you tear this for me, please? Thank you. The test kit is somewhat like a pregnancy test. It has 2 triangles, a C and a T. We must see a line at the C triangle. C means control. That line tells us that the test was done properly, we had enough blood.
Okay.
The T test line, if there's a line there, that means that your blood has been shown to have HIV antibodies. You've been exposed. Okay. So 1 line negative, 2 lines positive. All right, so let's go. What we do, quick and simple. Some people are so amazed at how fast an HIV test can be done.
So what kind of counseling? What you say to, ouch.
I'm sorry. One tiny finger prick. I didn't even prepare you for it, but I'm sorry.
What you say to people, like in terms of counseling? I mean, what
let them know.
What would I need to?
You would need to know, number 1, that your test is confidential. No one will know besides you. But if you test positive, we will have to let the healthcare provider involved in your care know your result.
Okay.
Right. And that's it. We start the clock running and we count for 20 minutes.
So 20 minutes,
right.
20 minutes I'll know what's going on.
In 20 minutes you'll know exactly what your HIV status is.
Okay.
So we prepare you, we find out emotionally if you're ready, and if you test positive, what kind of support you have in terms of friends, family, you know, how you'll cope, but just ensuring that you're ready for the counseling.
Okay. So now if I test positive, I go for additional counseling?
No. If you test positive, then you are referred to a physician, one specific physician that we use, and that doctor will take the blood from you, and usually that doctor is there at the testing site on Friday, so that we can catch the person on spot. We take the blood, send it off to the lab, and that is sent off to Tampa, Florida, where we have our reference lab for confirmation testing. The samples are sent abroad.
To make sure that it is correct.
Yes, it's verified. And that takes 2 weeks. And in 2 weeks' time, we contact you and we confirm your status, and then you enter into care and treatment, meaning that the same blood sample that was taken will be used to test for CD4 and viral load, how high of a level the virus is in your blood and how low, how suppressed the CD4 cells are. And then doctor will decide if you need treatment or if you can wait.
Okay. Now, in a case like me, for example, who have a significant other, how do you help me to deal with that? How do I deal with that situation?
Okay, excellent question. If you test positive, we have a contact tracing system in place where you would sit down with the contact tracing nurse and let her know your contacts up to the last 5-10 years, the most, as far back as you can remember. And we give you the opportunity to inform your mate. It's your choice, but we give you X amount of time. And by that time, you have to know if you're comfortable telling your mate or if you'd prefer the nurse to inform your mate.
Okay. But if I don't tell my mate right away and I have sex with her, wouldn't that run the risk of me transferring HIV to my mate?
Yes, you'd be intentionally infecting her, and that's why we give you the option to let her know right away or not. The nurse will contact her and let her know.
So, but it sounds like there's a time span between the time I'm to tell her and the time that you will tell her.
Yes.
And that's a dangerous time span.
It is, but
shouldn't the situation be that she should know immediately as soon as you find out?
But then there are laws governing contact tracing. We have policies in place, and we give the individual, and it's not just for HIV, it's for any other sexually transmitted infection. If you have syphilis, herpes, gonorrhea, we allow you time to tell your partners.
I understand.
I understand what you're saying.
But that's a dangerous situation.
Yes, but at the end of the day, you have to be responsible enough. I mean, anybody who's infected with HIV, you're going to go through a mirage of emotions. I mean, dealing with yourself. And I mean, there are people who will, yes, intentionally want to infect people to spite them, but at the end of the day, it's going to backfire. At the end of the day, it's going to backfire.
But I don't think, I'm not coming from a perspective that you would intentionally do it.
Right.
But, I mean, you could imagine what the trauma would be for a person to say, well, wow, HIV, I mean, there's a whole question of fidelity, the question of the relationship, the support that you need may no longer be there because of the circumstances.
So true.
And so all of that emotional information is going to make you, increase your fear of telling your partner. So therefore, that would suggest that would be a prolonged period, because you might say, wow, I can't go home tonight and say, well, I'll test positive.
To be honest with you though, Cromwell, the risk of infecting someone after they know doesn't change from before they know. So someone who's infected with HIV and does not know can pass the virus on without knowing. After they know, they are ultimately responsible by law. And there are legal ramifications, even here in the BVI.
Okay. So we need to know that.
Yes. And
if you're not going to tell your mate right away, you shouldn't have sex with them.
Exactly. You should not have unprotected sex with them.
You should not have unprotected sex.
Yes. And then I mean, any husband or wife who comes home and say, I'm going to use a condom, you're going to have to explain why.
Right.
But at the end of the day, that is a situation that we have couples who one partner tested positive, one negative. We have couples where both partners tested positive, and there's no proof of exactly when one passed infection on to the other. But at the end of the day, I haven't seen situations where people have withheld that information knowingly. They know they're infected and intentionally. I mean, the possibility exists, but...
And do you have counseling for partners, or how do you deal with that family issue? Because then you're talking about the potential destruction of a family. How do you deal with that issue?
That is very important. That's where post-test counseling comes in. That is why pre-test counseling comes in, to inform you of all the different situations, case scenarios, and to find out exactly how you will cope, what you will do. And we also offer HIV counseling and testing for couples. A lot of couples come in together. Some people come in and then they send their significant other. I'm not having sex with you again until you get tested, which is being very responsible. You're not just knowing for yourself. You're saying, I'm not sleeping with you until I know where you stand.
Okay. Now we know right away. Soon as you test, you're in a better position to repress the development of AIDS.
Yes.
And the medication becomes more effective from early detection. How the medications that we have now, how effective are those medications now?
Very effective. I always tell people, I kind of boast, we have the same medications that Magic Johnson have access to. We get top of the line antiretroviral medications in the BVI. We have procured it through the OECS Pharmaceutical Procurement Services, and we dispense them to our customers. We do get some from the Brazilian government, and they are very effective. They are the same that are used internationally.
Okay. And how important it is to follow the prescription?
Oh my God, Cromwell, I cannot overemphasize that point, because taking medications as the doctor prescribed, whether it be 2 tablets twice a day, 3 tablets 3 times a day, however, it is as important as a matter of life or death. Someone who is put on treatment and does not take it properly can develop resistance to that treatment, and they would have to be switched to a stronger medication, which is more expensive. Right now, persons who are on second-line medication pay approximately $1,800 a month for their treatment. There are more side effects. It's much stronger, so you have to deal with more horrific side effects, and it's not easy to cope with. So I would advise anyone who right now is taking first-line medications to take them consistently, even second-line, because there are third-line medications which the BVI does not procure at the moment. So we don't have any third-line in stock. So we have to be very careful.
Now, who's bearing the cost of the medication now? Is medication available to everyone, free, or as you can pay? How is the medication distributed in terms of cost?
Well, I did watch your show when you had the HIV/AIDS Foundation on, and we were a part of the process, meeting with the chairman and members of the board to discuss the way forward. And the HIV/AIDS Foundation has done a phenomenal job over the years of financing the cost. Government gives the HIV/AIDS Foundation an annual subvention to assist with that, and I mean, they do have fundraisers. But I know sooner or later things may change, and so persons may have to pay for their own meds on their own, and so it's very important now for persons to start developing a sense of independence and self-empowerment, going to the pharmacy, collecting their medications, being able to pay for their medications, and taking care of themselves so that they avoid going on more expensive meds. If someone is on more expensive medications and they do need help, they will get it.
What about insurance? Insurance covering HIV medication?
I know Bupa for sure covers 80% of HIV care and treatment, so only 20% will have to be paid out of pocket. And other insurance companies I know do, not all, but some do. And I know the health information system, that is one thing that the support group ensured, that HIV/AIDS treatment and care was covered under the National Health Insurance.
Okay, we gotta take a break.
Okay.
We're gonna take a break for word from our sponsors. I'm gonna come right back, and we're gonna open up the lines early, so during the conversation you can call and ask questions, make a contribution to the program if you wish. Keep it locked right here to Spotlight. Lots of more important information coming up. We'll be right back.
Spotlight is brought to you by Bolo's High-Tech Printery, Virgin Island Motors, and Clarence Thomas Limited.
Welcome back to Spotlight. I'm Edgy Wencombe here with the National AIDS Program Coordinator, Mrs. Noeline Levens-Clark, and we're talking about HIV Regional HIV Testing Day that's coming up this week, right? And it's already started, but the main day is on Friday the 29th, and it's going to be at Scotiabank in Roetown, and again, Bojangada.
Yes.
Where in Bojangada?
And the Scotiabank.
Scotiabank in Bojangada, Scotiabank in Roetown.
And you got a clinic in the settlement.
Clinic.
And Jos Van Dyke Clinic in Jos Van Dyke.
Okay. And it's easy to get tested. I just had my test, so this is my annual test. So it's like, as long as you're gonna come on the show,
you can use that as an opportunity. Wow.
I could get tested, right?
Yes.
So that's cool. And we've been talking about a lot of things. The phone number is gonna come up on the screen, and you can call us and you can ask Ms. Clark questions about anything you want to know about HIV. She knows everything there is to know.
I hope so.
More or less, right? statistics, what's happening in the BVI, we always hear that it's very difficult for us to get statistics. Is it becoming easier to get statistics? Are people becoming more forthright, less fearful? Is the stigma decreasing? All those questions in one.
To be honest with you, I believe more persons are more sensitized, they're more aware of how important HIV testing is. I know many persons go abroad to even have an HIV test done every year instead of having it done in the BVI. So there is still some amount of fear by our local population. In terms of our statistics, in 2008 we had 9 new cases, 2009 9 new cases, 2010 7 new cases, and 2011 6 new cases. So far we've had 2 cases reported for the year. Now looking at those numbers, it appears, it seems as if our statistics are going down, but not necessarily so. These are only the cases that are reported by doctors locally. There are persons who will not go to a local doctor. They'll prefer to go abroad, and so those statistics we won't have on file. But we can only account for what is reported in the BVI.
But still, all in all, it is a good sign.
It is.
Because let's just say that the stigma is decreasing a little bit. The test is easier. You're going now to the places where people are instead of waiting for them to come to you.
Yes.
And you have a slight decrease. I mean,
it says a lot.
It's a good sign.
And it's not just a good sign. It means that the BVI is better able now to report that we have achieved Millennium Development Goal number 6. All countries of the world have signed on with the United Nations to achieve 10 Millennium Development Goals. We call them MDGs. And MDG number 6 is to begin to lessen new HIV/AIDS cases, and we are seeing it. But we can't raise our hats and say hooray as yet, because this goal is supposed to be achieved in 2015. We still have this year, 2013, 2014, and 2015 to go. But I'm hoping that as long as people know their status and they're accessing care and treatment, that we'll be able to achieve that.
But you know, this is the 6th month of the year.
Yes.
And you had 2 reported cases.
Yes.
So that's 2 reported cases in 6 months. That would mean at the rate you're going, you'll have 4 cases.
We don't know. We don't know. To be honest with you, we don't know.
Just a little optimism.
I know, but, but over the years, like when we track the record, we've had like 3, 8, it jumps up and down, and then we had like 15 in 1984. That was the year that we saw the most. And then it came down. So sometimes you have those little surprises.
You can't tell for real.
No.
Yeah. But at the rate you're going now, if you get 4 this year, you'll be saying something. You'll be down from 6.
Yes.
So that would be what, 30% decrease.
Yes. But it's not that we want not to have HIV cases. We want people who are HIV positive to know that they are HIV positive,
and to come in and get tested,
and to get treatment.
And to get treatment.
Yes.
Yeah, because the treatment increases the quality of life.
Yes, it does, and prolongs life and makes it much better.
People are saying now that HIV is somewhat of, but you could put it in a category now of a chronic disease.
It is.
How is that a true statement?
It is a true statement.
But there's some significant differences between, let's say, HIV and diabetes.
Yes. HIV is classified as a chronic communicable disease. Diabetes is a chronic non-communicable disease. You can't catch diabetes by sitting next to me or having sex.
Right.
With HIV, it is sexually transmitted. But it's a chronic disease because antiretroviral medications, the treatment, has now prolonged so many persons' lives that many persons are living longer. The death rate has declined. No one is dying of AIDS. I mean, no one has to die from AIDS anymore. And so people are living longer, and so it's considered a chronic disease. And so we're actually seeing complications of people who have been on treatment over the years, especially if they're not managing well. And so just like someone with diabetes who have to take their medications on time, eat on time, someone with HIV has to do the same. See their doctor regularly, get their blood tested, and all of that.
Well, it's sort of, well, I won't say a catch-22, but it's a situation where it's good and it's bad, that it's more difficult to die from it now as long as you detect it early, or you detect it at a reasonable point, and you take the medication on a regular as prescribed basis.
Yes.
You have a prolonged, better quality of life. So so it seems like the fear of HIV would diminish. Now, that could go both ways. It could be that the fear diminished to a point where you become complacent,
Yes.
and not want to, and feel like you don't have to get tested because you're not going to die really, and again, you could live with it. Or that you could get tested now, the stigma is reduced because it's, you know you can't get it by touching somebody or holding their hand or so on. It's sexually transmitted. You know that you're going to live longer and have a better quality of life.
Yes.
So why not know your status? So it could go both ways. So should you, as the National AIDS Program Coordinator, be using that as a strategy to try to get more people to come and test it, and to diminish the stigma from a marketing perspective?
Should I be using it or not using it?
Should you be using? Yeah, is that
because there's
are those advantages? No. Can those advantages of early detection, better medication, increased quality of life, prolonged life, can those be used? Those developments be used to encourage persons to get tested and diminish the stigma?
They are being used, to be honest with you, and there are persons who still believe you got to die from something anyhow, so what the heck.
Okay.
And there are persons who will just be as careless as they have always been, not caring who they sleep with, not caring what their HIV status is or their own. I mean, and that's just a small percentage of the population. And so we have to find ways to reach people where they're at. But those that you just mentioned are the reasons why we promote HIV testing. We want people to know and to live better.
Now, we talk about the rate of infection, and we see so a little downturn, a little trending downwards, which is good, but I mean, it's unpredictable. What are the numbers now, the general numbers?
You mean in terms of the Caribbean?
In terms of, well, okay, give me the Caribbean first,
okay.
And then the BVI.
Okay, the Caribbean itself is also seeing a slight decline, especially between the 2001 and the 2011 statistics. Some countries have dropped their new HIV infection rate by as much as 25%. Countries such as Bahamas still continue to maintain the highest prevalence of 3.1% of their population being infected. Countries like the Dominican Republic have seen a decline. They've gone down to 1.9%. Jamaica, 1.7%. And we do have Trinidad and Barbados lagging behind. Haiti and Dominican Republic are classified in the same category as one nation. Every year, the Caribbean usually sees at least 17,000 new infections, and that is slightly declining. The death rate has definitely gone down. Mothers passing the infection on to infants, that has been reduced in most countries. And our goal is to keep it less than 2% of babies born with HIV. But regionally we are doing better. We are seeing a downward trend. It's not significant, but it's giving us hope that what we're doing is working.
Can we look at, say, the Bahamas, who's maintaining the higher rate in the Caribbean, and look at them from a social perspective to see what the lifestyle is like there, to make a comparison to those places with a lifestyle with diminished rate?
Yes, that's an excellent thing to do. There are assumptions that the Bahamas has a very high homosexual prevalence, but that is not confirmed as yet. I mean, I would have to get information from the Bahamas Ministry of Health to confirm exactly what are the key factors.
That's a rumor going around.
That is one allegation, that that is the reason why their prevalence is so high. That a lot of men who have sex with men take risk. They have risky behaviors in terms of sex. Cuba, on the other hand, handles HIV differently, and Cuba has the lowest prevalence rate in the Caribbean, 0.5%
of their population.
And that's because
they acted very quickly in the very beginning.
Yes, asylum. You go, as long as you're infected, you go to an asylum for 8 weeks. At first, it was stigmatized. I mean, you were looked down on if you had to go to the asylum. Now, Cuba is finding that people who are infected, everyone who's infected, want to go to the asylum. because you get to learn how to take care of yourself, you get to understand the disease, understand the treatment, you get support not just from your family but also from persons who are infected, who you met at the asylum. So people are doing better.
Great. Good evening. This is Joyce Marine.
Yes.
Yes. Good evening, Joyce. Good to know that you're watching. I wonder where you're watching from. Are you here or are you watching from where you are? I'd like to know that, please. I would like to publicly commend Noeline for the great work she's done and continue to do to bring greater awareness of HIV/AIDS. Scotiabank is so proud to sponsor annual awareness, and we are committed to doing whatever is necessary to sensitize our community on this virus.
I am so happy to hear from Mrs. Marine, and I'm also proud of her, not just Scotiabank as a whole, because all around the world Scotiabank is doing this. They are like the forerunners. They provide the space for it to be done. But Mrs. Marine, as the manager of our local branch, she ensures that it gets done and gets done well.
Yes.
Yes.
So that's good. Please text me again, Joyce, and let me know if you're looking at us streaming on jtvlive.net.
And I'd also like to say thank you, Mrs. Marine, for your kind words.
Yes, yes. Very together, sister.
Yes,
very together, sister.
Yes, she is.
So we have a slight decrease. We need to be looking at the lifestyle changes that are helping us to decrease.
Hold on, before you even ask, I'm glad you said that, because HIV/AIDS has brought to light our lifestyles as a Caribbean people, as an African nation. What behaviors do we have in our social environment that contribute to us having the highest prevalence in
all over the world?
In the entire world.
In the entire world.
Our populations are not...
As an African people, wherever we are, we got the highest prevalence of
even HIV.
That is serious. That is serious. But I mean, that's a good question. Has anyone or any group, anybody take a look at the social implications of that statistic?
It has been looked at. I mean, in so many different contexts, because we as a Caribbean people, we rate highest in the world when it comes to downloading porn. The Caribbean region. We are second to Thailand when it comes to sex tourism. Yet we refuse to talk about sex in our churches. We refuse to talk about sex in our schools. It bombards young people via technology and so many different mediums, and yet still we can't have healthy conversations about sex. A man is regarded as a stud, especially a black man, and he's fully loaded, so he can service a lot of women. Men can have sex with men, and that is fine. Whatever an individual chooses to do with their body, that's their choice. But being deceptive to the point where you can sleep with who you want to sleep with and still come back home to your wife or your woman, it says a lot about what we're doing and how it's backfiring on us. I mean, HIV has brought to light, because STIs have been around for a while. We've had syphilis, we've had gonorrhea, but guess what? You go in, you get a penicillin shot, you're good to go. Herpes cannot be cured, hepatitis B cannot be cured, HIV cannot be cured. And unlike herpes and hepatitis B, where you might not see it in a person, HIV will show over time if you don't get the treatment.
It will manifest into
it will show itself. So I mean, it has brought to light our behaviors and the need for us to talk about sex some more, talk about it in a healthy way that can build people up.
Well, that brings me to the question, is it only that we should be talking about it, or we should be really looking now to change our lifestyle? Is it that we like more sex than anybody, but anybody else? And then this is a serious question that needs to be answered. We need to answer that question for ourselves. What has happened to us over time? And I don't know if you could say, well, I know slavery had a lot to do with a lot of our behavior, but there were a lot of Africans that were not enslaved, on the continent. So then slavery won't be a factor with them. I don't know what colonization, because colonization was the part of slavery that wasn't as severe as the transatlantic slave trade itself. But the mentality that came along with the slave trade also came with colonization.
Yes.
So, so I think somebody need to study that, and so that they could tell us what has happened to us and what we need to change about ourselves, or how we need to evolve spiritually in order to deal with some of these issues that we haven't known.
And then you talk about spiritual evolution. At the end of the day, look at the songs that rank highest among black populations. Songs that promote sex, hardcore sex. Songs that promote violence. I mean, look at the different things, that are derogatory, demeans a woman. And those are the things that get prominence in our societies. And what I'm trying to say is that we grew up in a time where we were a bit sheltered in our society. But now, like I say, young people are bombarded. People are bombarded day in, day out by the songs, movies, everything.
We walk around with a constant constantly sexually alert.
Yes.
I was just talking to my wife, and we were going over the schedule for the village.
Yes.
And this guy, Christopher Martin, I think, is one of the acts that's coming. Okay. And he has a song, says, Lord, this is Cheating Prayer, I think is the name of the song.
I know the song.
Lord, don't let me cheat on my girl. Help me not to cheat on my girlfriend. But if I cheat, help me not to get caught.
Yes.
Yes. Talking about
it's a very popular song.
Talking about lyrics,
yes.
and then most of the acts that's coming,
yes.
Is sexy. Dexter, she performs in Next to Nothing. I saw a lady on the poster from BVI Land, as a matter of fact, on a poster with a top. With with her panties in plain view and nothing on at the bottom, So,
but then you see, Carmel, that is one of the effects of urbanization, where our society is evolving, and it has evolved from where it was. But at the end of the day, we have to be able to discuss it in forums where we have captive audiences to ensure that people are enlightened on both ends.
We're going to take a break.
Yes.
Yes, and we're going to come back, and of course the phone lines are open. Text is there as well, so you can call us, you can send us a text and let us know that you're there and what your thoughts are. We're going to come right back after these words from our sponsors. Keep it locked right here to Spotlight.
This program is sponsored by the law firm of J.S. Archibald & Co. and by the trust company J.S. Archibald Trust Services Limited, both of Rotown, Tortola, BVI.